morning and welcome to this press briefing. First of all, I would like to take this opportunity to apologize to all of you for the late start of this important event. This is something that, that is beyond our control, but finally we're able to make it. We are very happy that you are here. As usual, anytime the media is called upon to come and work with us, for us to be able to disseminate the right information to the public, you are always available. We want to thank you people for the cooperation and partnership over the years. We are very grateful as a ministry to all the media houses in this country for responding to our calls, especially at the time when we are also needed. We now want to start this meeting, and today I have on my right the Register of Births and Deaths in this country, Mr. Lamin B. Fati, who is here to talk with the public and to face the media, and for us to be able to know what our strategies are with regards to the current mass registration we are doing with regards to birth and also National Health Insurance Scheme. We are doing two activities. We are currently registering births, and we have identified areas. These areas have been used by the people who have been trained by their team to be the IT officers, to be the recorders, and as well as also data entry clerks, and people also who are also there to manage the crowd. So we also have, along the process, we are also registering birth, and also we are registering people also for the National Health Insurance. So Mr. Fati is coming from the birth registration unit under the Directorate of Planning and Information. Mr. Fati, you are most welcome.
Thank you.
Today, we will be discussing with the media so far where we are with regards to the registration. I know some areas have been covered, some areas are not covered, so Fati will make some highlights on that. We also have identified strategic locations in the greater Banjul area and Banjul. Like, for example, Banjul, there are teams that are also there in the various locations in Banjul, and we also have teams also in the KMC. And then in the KMC, we have teams from Tabokoto and down up to Bakau. And then we also have teams that are also going to move to the West Coast region in the coming days. So this is a very important exercise, and we want each and everyone to take this opportunity to register their birth, and as well as also register for the National Health Insurance. And it's a unique opportunity that people need to capitalize on and take so that they can also be able to have these documents at their disposal. On that note, I now open this meeting on behalf of the ministry, and now invite Mr. Fati to give us some highlights as to what is happening, the team movement, and as well as also the criteria and also the documentations required for someone to be registered for the birth, and also documentation required for someone to be registered for the National Health Insurance Scheme. Mr. Fati, you are most welcome.
Thank you very much, the media present and all the stakeholders for today's meeting to highlight on some of the issues that are pertaining to the mass electronic registration and the issuance of the National Health Insurance. The Gambia, we're targeting everybody in two folds. One, all eligible Gambians, or all Gambians are targeted in birth registration. They should be given new birth certificate, irrespective of whether they had a birth certificate or not. And all residents, including the nationals of the Gambians, are all eligible for insurance card. So this strategy had been, we train people to, who should be trained on user devices and modalities of registering. And this had been, I've trained them on 3-4 times to ensure that they have the skill and ability to deliver the services as expected. That being the case, the service providers have been selected from many based on their competency, expecting to deliver as expected of them. Nonetheless, we don't also stop there. We also ensure that we have the efficient technician at the background, that we train extra IT officers who have hardware knowledge, not only software, so that these people can help the team once they are in the field to address any situation that may arise due to the user devices that the computers or the printers we have deployed in the field. Due to the sensitivity of the materials that we procure and how delicate they are, we don't want to leave them in that way. And also we want service to flow smoothly, that people will not queue for long waiting for one single service. It's a what we call one-stop shopping. When you come, we want to give you the certificate, we want to give you the birth certificate, we want to give you the health insurance. So that being the case, it creates a lot of demand and also time, both from our side and the consumer. So here, when you come, we ask you the required documents. When you fulfill all these required documents, you're given a birth certificate alongside with the health insurance card. Some may ask, what are these requirements? One, you must be born in the Gambia, and you have an identity card that we asked. But further, we also align ourselves to our parents. If you don't have parent supporting document, how do you align yourself to those parents? The challenge we have is that most of the people will come with the ID card. That doesn't show alignment to their parents. And legally, all children born should be aligned to their parents. That's why parent documentations are needed for one to go. In the absence of the birth certificate, the ID card, we ask for infant welfare card for children, particularly those 0 to 17. You can come with the infant welfare card, together with the parent support document to align the child to the parents. In the absence of, for example, if the father has not accepted the child to be his child, the child will be registered aligned to the mother. That one, the child's rights should be given because the child was born in the Gambia, and that must be protected. So therefore, it is essential all the time for people to come forward with the parent supporting document, because paternity is a legal issue. We don't compromise that one. Paternity is a legal issue, because now, if you put somebody as the paternal father of the child, you're inferring the legal responsibility, child maintenance, security, ensuring that school, health, education, and all other that need to, the package of child maintenance should be the responsibility of the father to ensure that he is the biological father of the child. Where you cannot establish this, that's why the registration officers will insist you must produce documentations. And also, why this is also assigning a paternity to a person, you are ensuring that the person will have inheritance, access to inheritance of that person. So these are all legal issues. That why the law is saying that you must produce some of these supporting documents to ascertain that you are the biological father or the biological father. If the caregiver is the one coming, or even the parents, you have to come with those documents to ensure that you are fully documented. Where we're making some compromise, we said 50 and above, maybe some of them, if you ask them their documentation, because Gambia is known to have poor documentation strategy in most of the areas. That's why we said if they are more than 50 years and above, and elderly people are there to assess whether they are Gambians or born in the Gambia, and those are the parents, because what we are avoiding is tomorrow claiming for inheritance somewhere else using the birth certificate to authenticate what they are claiming for. That's why these are legal requirements for one to ascertain that who is the father. For example, I use Morinjai. They have a property in Mandinari. If I want to claim the land now, I must be Njai, so that I also have a property. Of course, the parents are no more alive. So where do we have to, for arbitrary? Is a documentation that will show that I have no right there. But if I'm able to produce a birth certificate bearing his father's name, he will not have any legal right to deny me. And these are the things that we're saying the documentation must be completed. It doesn't mean we are denying anybody. So those who are eligible, if you are fulfilling all these criteria, you'll be given both birth certificate and then the health insurance card. In the absence of infant welfare card or ID card, we said you must go to the alcalo to attest. The alcalo where you are born, not where you are resident. Where you are born, you must go to that particular alcalo to attest that you are born in his community. And in there, the alcalo statement alone is not enough. It should also accompany with the endorsement of that statement by the district chief. We know that the alcalos are answerable to the district chiefs. But somebody may ask, what about those in the Greater Banjul area? we do have similar structures in place. They are local authorities. And this one, in the absence of district chief, we have the mayor in city of Banjul and the Kanifing municipality. The alcalos in this one, in the KMC, are answerable to the mayor of KMC. So therefore, attestation from the alcalo of KMC must be endorsed by the mayor of KMC. Banjul, somebody may say, yes, but Banjul, we have no other alcalos, we have wards. There are 7 wards in Banjul. So those are the things also, the statement must be vetted by ward councillors and also by the mayor. That's the way the procedure goes, so that everybody is captured and is given. Because we don't want to water down our national documentation for any Tom, Dick, and Harry to come and sit and claim government citizenship, and we just give it because you want it. No, it is not like that. You can peacefully live in the country. If you are entitled for this certificate, it will be given to you. Where we know that everybody seeks healthcare, so that's why it becomes inclusive for everybody to be given healthcare. Gambians, even born in diaspora, are not born in the country, but they're natives. So they are also given this birth certificate, provided that you fulfill the criteria. This includes your birth certificate for the country of birth and your parents' supporting document indicating one of them to be a Gambian. Then you become entitled to be given a Gambian birth certificate. This is a simple strategy that we are deploying in the field. We are not demanding anything, and the service is free of charge. We walk to your doorstep to give you the service. But the legal requirement must be fulfilled. That's why we cannot compromise on that standard to say that anybody who comes, we give it to you. No, you have to fulfill the standard criteria of that one. For example, somebody may be a Gambian, but not born in the Gambia. Those who naturalized are not born in the Gambia, so you cannot give those people a birth certificate. The birth certificate is only meant for Gambians, right? Either born in diaspora or so. But if you naturalize, you are not entitled to a birth certificate. You are entitled to the naturalization document, which, if you flout the naturalization protocol, it can be withdrawn from you. But if he issue you a birth certificate, it cannot be withdrawn. It's once and for all. So these are the legal things one has to be cleared of. If you are naturalized, and then you are in the country here, you can be given the health insurance card, but not the birth certificate. You can also be given a passport based on that one, but not the birth certificate. You may have all the other national documentations except the birth certificate. That one is very unique. It's aligned to inheritance or descendancy or being born in the Gambia. If you're born to non-Gambians in the country, you are also entitled to be given a birth certificate. Your parents are from other countries, settled in the Gambia. You're born in the Gambia, we'll give you a birth certificate indicating that you're born to a non-Gambian parents. So that when you go back home, you don't become stateless. So you have to align a child to the parents. That's the simple procedure. In this mass registration, we divided the country, the target duration for the whole exercise 3 months for the entire country. Bear in mind the target is about 2 million plus, if it will be. That's the target we have. And then we want to move from one region to another. We started in Banjul. Now we're moving in the KMC, where we'll be for the rest of this month. And then next month we'll be moving into West Coast, Brikama and the region. The following last month, that's October, we'll do all the remaining regions from North Bank to Basse. We'll treat them, all of them, and we have specific period when we will be there. And then we have a strategy to inform them. We can inform them in advance, but knowing the nature of people we are, how many of us have a diary to be remembered? So these are some of the things. Even naming insurance, if you give the day the child is born and said my wife had delivered, and want them to attend on the same day, the tendency of people forgetting are higher. So as we approach them, when we are about to come, we'll give you advance notice to that particular area. If it is a local authority, we want to use the local structures to inform them that we are coming. The alcalos are very important in this one. The Council of Elders are also important in this service delivery. We're using all the local structures. Like, for example, today, we'll be delivering a formal letter to the mayor. We've already called him and informed that we are coming into his area for his support, and then, see how best this stakeholder issue can be enhanced further. Because birth certificate is a cross-cutting issue. The local authorities are also stakeholders. Population security are stakeholders. National Immigration and Department are also stakeholders. All others are all stakeholders, the school and others. Some will say, we have not been fully informed. No. When you heard it from the national radio to say that we are giving this service to the community and it's free of charge, everybody is invited on board to come on board. You don't have to wait until you are called by your name. That will be difficult to call by your name, but we want to use all the structures, and in the media in particular, to be writing up this one. You don't have to wait on only this discussion. You can visit the field and see what is happening, and then ask any challenges that you may see. Ask us again, come on board and ask for clarity. There are certain things will be. And then the other issue I want to highlight here, this program is a national program. The mass registration is one of. And then there may be errors that may occur while delivering these services. We are not doing any correction in the field because the system must be controlled. Anybody who is giving a service and there's a minor error on it, you have to wait until after the exercise. We'll create a system, because it's a system, it's an electronic system. We cannot be opening it now every Tom, Dick, and Harry to be doing the corrections. That's why there should be proofreading or inform the applicant what you have stated about them. If they confirm it in detail, then it goes to the approving officer, who need to proofread and verify all the characters are all intact before send for approval. Once you send for approval, the system will not allow you to do the editing. But once the approving officer is verifying information, he has the user right to edit any error that may occur by the data entry. So here, the information is that any information input, if it is wrong, just like the computer is garbage in, garbage out. And the correction cannot be done in the field at the moment, because it's a system that we are controlling. It's a national system. We cannot wait everybody or to have access to that one and be able to use it anyhow they like. Otherwise, the hackers will be able to overcome us, and we cannot control them, because wherever, even the advanced world, the hackers will penetrate their system. Much more here we are developing, and it's a new system that we are putting in place. So that's why we are very careful not to allow editing to be done at that stage when it is printed. Editing can be done before it is sent for approval. That can be done. But once you said confirm everything is okay, the server will capture it, and you cannot do any changes on that one. I have the user right, but I'm not deploying that one now. What we agreed as policy level, we withhold all changes or errors or corrections of errors until after the campaign. Yeah, thank you.
Thank you very much. Elaborate.
Yunus. And the second name, you have two names, but you're Yunus Sajo. Yunus Saliu. Thank you very much for that question. The National Health Insurance is meant for all residents in the country. Once you are staying in the country for 3 months and above, you should be entitled to be given national health insurance, because we are all human and we all can fall sick. We are all exposed to, prone to illness or disease. And you must seek health care from our facilities, either private or public. One way or the other, you must seek health care. And human race need to be honored and respected. And then no man is indispensable of health. Therefore, it is important to capture everybody. The others are national documentation giving you a legal right, or those ones. Those are the, but everybody is entitled to. It's your human right convention to say that the convention is saying that it's human right for you. You're entitled to your name, identity, and also access to healthcare. So the Gambia government also is opening its agencies, both private and public, for people to seek healthcare. And then healthcare comes with cost, and it's always difficult. So that's fair. Therefore, everybody, both residents and non-Gambians in the country, are entitled to health insurance. The system is such a way that it gives you command to say print for healthcare, insurance, or print for birth certificate. The printing cannot go together. It commands you whichever you want to print, that's what you print. The biodata of information that you want to capture on the health insurance is similar to what you capture on the birth certificate. But when you come to the final end, are different. So birth certificate is only meant for Gambians, and health insurance is meant for all. And it is their right for that to be prepared and given to them. It is their right for them to come on board and register. The tendency is why we are avoiding, we don't want to leave them behind. If you don't register and you go to the health facility, you are asked about your insurance card, because there will be some condition laid in terms of healthcare services. What we have now, if you go to a health facility, our complaint as a government, we said, we don't have drugs, we don't have this, we don't have that. The healthcare has come to address such a situation on the ground, because there will be insurance scheme is such that it will be a comprehensive one, and then there will be even exemption that the insurance authority will give you further. But we informed that there will be exemption for those who cannot afford. But that one, the insurance authority will have to come and clarify further. Now, we don't go into detail, but everybody, we know that everybody, one way or the other, you must fall sick and you must seek health care. And the other one, the duration why we said 3 months, we anticipate, we have done a mathematical calculation. If a team is able to register this number of persons per day, we've done the projection and then we have come with the conclusion that within 3 months we are able to finish if the system goes smoothly. And we have the cooperation of the public, then everybody queue one after the other. In a chaos situation, we cannot do it. In an orderly manner, if people queue, if 100 people come to a registration center, they will able to, the team will able to take care of you and provide you service. And we are moving in such a way that every area is accessible. We are using IEC voter registration centers as access points, so that these were used before several times by the people. So somebody was even asking, what about rural areas? Everybody, our fear is not even rural areas. Our fear is the people of in the urban areas, because sometimes we feel that we don't have time. We don't want to create time for anything, and it will be there without anybody asking us documentation. So that's where. But rural people, if you give them a service and say this is available for you and it's free of charge, they make more effort to ensure that those services, they don't miss them. So we'll be moving around, and we'll even say, we'll give messages or information in advance to those areas. That's why we are saying our community structures will be used, the local authorities. Our even traditional communicators will only be used. We will not rely on the media here, because probably my grandmother is in the provinces and doesn't have access to radio or television. Him or will see relate on is the Kanyeleng or the other Bantapa approach, which we know that the message will be delivered. And we have town criers who will be used in our communication strategy to ensure that the people, we have VDCs, we have the multi-facilitation teams. These are all things, and then child groups, children group that are advocating for the well-being of the children and the community. So these are our CCP committees that are all in existence, will be used to sensitize the masses so that people can come on board and register, and they will have the service.